Welcome to Techstination. Joining us is Dr. Gene Ukrainsky, the co-founder of a company called Zipnostic. Thank you for joining us, Dr. Ukrainsky.
Thank you for having me.
Well, what is Zipnostic?
Well, Zipnostic is sort of a new digital version of the old-fashioned medicine. So we enable a direct medical record over direct medical examination over the internet. We have a medical tool set and medical care coordinators that reach the patient at any location where the patient might be, and they establish a direct communication with the doctor via HIPAA-compliant web-based platform. And the doctor actually conducts the physical examination, able to communicate with the patient and make a diagnosis and create a treatment plan without patient ever leaving their location.
So describe what is in the Zipnostic kit and how this all comes together.
So we actually capable of conducting a full medical exam. We're able to take all the vitals, temperature, blood pressure, heart rate, actually pulse oximetry. We actually also have our proprietary digital camera that allows us general intraoral ear and eye examination, and also dermatologic examination. We have, of course, a stethoscope. We also have a 12-lead EKG. Because we cannot touch the patient, we certainly can screen the patient with a portable ultrasound, and that's also included. And in other words, everything that you see in the doctor's office when the visitor's doctor is included in this medical kit. And therefore, we're conducting a physical exam as you would in a general physician's office.
How did this come about?
It's come about basically from a desire to help the patient. I would say 4 to 5 years ago, I was just, we co-founder were a little bit frustrated with the way the waiting room was organized. A lot of chronically ill patients. I myself, by trade, as an ENT head neck surgeon. So we have a lot of chronically sick patients which were being transported to the office for the routine visits 1 to 2 times a month. And the idea stemmed for simply helping the patient to improve the quality of the medical care delivery, and also help the doctors to better communicate with the patient, because a lot of those patients are well known. The visits would take a lot from them, and really it was with the modern technology, we thought that we can do a little better. A patient doesn't necessarily need to leave the home. Doctors and hospital facilities and urgent care facilities doesn't need to really have this long waiting line in the waiting rooms. And from that stemmed the idea of Zipnostic, of how can we deliver the best possible quality medical care at the patient location. So we wanted to improve the care, to improve access to the medical care, and value patient convenience.
So you've got a trial that you've launched in New York City with this. Tell us about it.
Sure, that's correct. So the whole system, of course, includes coordination of the doctors, on-site care coordinators, and the whole digital platform built around them. So our trial started in New York City. We are on Upper West Side, Chelsea, Tribeca area, in Hudson Yards. And we are serving the communities where you as a patient can basically dial in on the Uber-like platform and make an appointment with us. The appointment can be guaranteed, and you can schedule it within 1 hour or up to 2 weeks in advance. So far, the pilot has been very successful, and hopefully we're planning to expand the coverage somewhere in the late September.
It sounds like there are logistical issues because you're actually having somebody bring the equipment and be with the patient, right?
Correct.
How fast can this be built out, expanded?
Sure. So the system is built out in such a way. Firstly, on-site medical coordinator is a specially trained medical technician, and we work by the zip code. So we have our teams arranged so that they're strategically placed in every zip code, and therefore we're able to reach the patient within an hour time anywhere that we expand our service. And that's the convenience of the system. That's number one, because we're working by the zip code. And the second, it also elevates a lot of unnecessary expenditures, such as transporting of the patient, such as waiting in the waiting line. And also, it preserves the personal touch, because the actual doctor is the one communicating with the patient and conducting the physical exam. The assistant becomes essentially the extension of doctor's hand.
How do the costs compare with a typical office visit?
So it's a very comparable cost because right now we have a special discount where the visit is only $50. Once we're fully operational, we're planning to charge $150 for a visit. So I think in today's medicine, where any conversation with a private doctor will cost you $300 and upward, this is a very comparable and compatible model. And when we compare the cost runs of urgent care centers and big offices, in other words, how much their organization actually spend to see the patient, we're much cheaper and much leaner. So there's economy of scale, and there's a cost saving for the system overall. But also, I think we try to keep the prices of the visit at a very reasonable price point.
And how might insurance companies view this? I know some are involved with some telehealth applications.
Sure. We think one of the beauty of having this digital system is that every minutiae detail of the exam is, of course, recorded. And we are gathering the information by the CPT codes. Of the most CPT codes are the ones that basically the codes that the government designated each diagnosis as a specific 4-digit code. And what happens then, we collect those codes and we look at the prices that at how much actually it costs to us to examine the patient with certain diagnosis. And so far, there is a tremendous cost-saving benefits, both for just urgent care type visits and for the chronically ill patients. So we think we will be able to present a nice data-supported argument to the insurance and show them how much better the system is economically, and also as far as the patient satisfaction goes. I think most of the patients would be much happier with convenience of this type of service.
And does the person who is actually visiting the patient have the ability to deliver prescriptions or injections, etc.?
Sure, the doctor is, because the person is essentially becomes extension of the doctor's hand. But like with any digital platform, as the doctor establishes the diagnosis, he will be able, and he or she is able to actually send a prescription electronically to whatever the pharmacy that that particular patient prefers.
What about things like injections, etc.? An office visit would be necessary for that?
Most likely, yes. We're able to partner and collect the patient draw blood. But as far as the injection concern and the treatment, such as chronically ill patients, for example, on chemotherapy, that still has to be done at the facility.
So from the patient's perspective, they would download the app for this?
That's correct. For the patient perspective, they just download the app on the whatever mobile platform, and they can call us pretty much the same way they call Uber. and we guarantee the visit within an hour, and you can schedule an appointment within an hour or upwards to 2 weeks in advance.
For more information, where can people go?
For more information, people go to our website, Zipnostic.com, and we have very nice instructions, as well as testimonials and graphic explanation of what it is that we actually do.
And how are your fellow physicians that you've spoken to feeling about this?
Well, so far we have a small group of dedicated physicians, and we have overwhelmingly positive response because the patient actually and the doctor spends much more time interacting with each other than they would in the normal office visit. This is a direct communication. There's also a tremendous convenience for the doctor that can be at home, that at their computer at whatever location that they are. It also allows a tremendous flexibility in their work schedule. So far we have a very positive response from the doctors who work with the Zipnostic.
Again, it's Zipnostic, Zipnostic. Dr. Gene Ukrainsky, thank you for taking the time with us.
Thank you for having me.
Now this. Innovation. Hi, I'm Fred Fishkin, and I've been covering consumer technology for a long time, and it takes a lot to impress me. That's why I'm excited to tell you about the latest way to enjoy cooking in the great outdoors from my friend Patrick Sherwin and his great team at GoSun Stove. What if you could harness the sun to cook your meals anywhere you go, day or night? The GoSun Fusion arrives this summer using the company's tried and true reflectors and a solar vacuum tube to get you cooking without the mess of charcoal, heavy propane tanks, or smoke. And with an optional solar panel and battery storage, and the ability to plug in at home or on the road, you really can use the GoSun Fusion to cook anytime and anywhere. Want to learn more? Head to gosun.co and use the code TEXTINATION to save 10%. That's gosun.co.